Welcome to the Department of Communication Sciences and Disorders, Speech-Language Pathology Graduate Program Information Session. We are on the quarter system here at Western, so let's take a look at an example academic calendar so you can get a feel for the times before we start talking about the program specifics. We do have a fall quarter, a winter quarter, a spring quarter, and a summer quarter within the SLP graduate program. Fall is about 10 weeks and it goes from the end of September to the beginning of December, and then you have a holiday break. The winter quarter starts in January and that goes through March, and then there's a spring break. In spring quarter runs from April to the beginning of June, and then there's a short break before the summer quarter, which is a 6-week session, so that's pretty short, and that goes from the end of June to the beginning of August. So that means that summer break is most of the month of August and about half of September. The SLP graduate program is about a 2-year program. We have a specific lockstep program, so you go through with a cohort of the same peers, and it typically lasts for 7 quarters, including that summer quarter in between the first year and the second year. The CSD program is a combination of academic coursework and clinical experiences. So first, let's talk about what the clinical experiences look like, and then I'll give you an idea of what the coursework will look like. In the first quarter, in the fall, you'll have, of course, your academic courses, and your clinical experience is on campus, and it's with a co-clinician who is a second-year clinician. So the first-year clinicians in the fall do get clinical experiences, but those are supervised, and they're in conjunction with a more experienced student clinician that you share your client with, because we want you to kind of get your feet wet first while you're doing those academic courses. Then, in the second quarter in the winter, you become independent with a client or two. So in our campus clinic, you are no longer paired with a co-clinician. In the third quarter, again, you're in our campus clinic, but we're going to add a little bit more to your clinical requirements. So you'll begin a clinical rotation in addition to the clients that you are serving individually. So we have 3 clinical rotations. Those are our diagnostic clinic, we have a Head Start rotation. We also have a rotation through our oral rehabilitation clinic. So you will do those in the spring of your first year, in the fall and the winter of your second year. So you will rotate through all 3 of those clinics at some point while you're at WWU. And then in the summer, you are again on our campus clinic. In terms of your clinical experiences in the fall of your second year, you'll be in our campus clinic and you will be serving as the more experienced student clinician for those new first years. So you'll have some combination of serving a client in conjunction with your co-clinician. You may have some independent clients. You'll be in one of the clinical rotations. And sometimes there's a possibility at this point to go on a part-time internship off campus, although the majority of those opportunities come in the winter of your second year. So sort of the same kind of mix can happen in the winter of your second year. You'll have some clients independently and with supervision, of course. You'll have your clinical rotation, and you can choose to do a part-time internship. And those are optional, so you can also choose to stay in our clinic. And then in the spring of your second year, you'll have a full-time internship and no academic courses. So you'll be completely off campus with an internship supervisor at a clinical setting. At this point, I usually get some questions about if we have a generalist track or a school-based track or a medical track. And our option, or our aim really, is to provide general education so that our graduate students can adapt to many different work settings. So we don't have a specific medical track or a specific school track, but we do have a variety of clients coming to our clinic across the lifespan and across the disorder continuum. And we do also have relationships with internship supervisors who are in school-based settings and who are in medical settings. So we do offer that full complement of experiences. In terms of your coursework, the academic program is a lockstep, like I mentioned before, and students move through the program as a cohort together. There's anywhere from 19 to 21 students, it just depends on the year. And this is an example schedule by quarter. This isn't necessarily the order in which you would take the courses, it's just an example. So we offer graduate level courses in research methods and in voice. We also have a developmental language sequence where we have developmental language disorders 1, 2, and 3. We have you take an assessment course before you go into the diagnostic clinic, and we offer stuttering and speech sound disorders. We also have courses in aphasia, cognitive communication disorders, and motor speech disorders. We have a counseling course. We have an AAC course. In the summer, we offer a resonance course, and we also offer an elective course on autism. In the second year, instead of having a comprehensive exam process, we have elected to instead have a professional issues seminar series, where in the quarter 5 and quarter 6, you'll sign up for a professional issues seminar series and discuss issues that are related to our professions, and you'll be doing some presentations in those courses. We have a choice that you can take a course that provides you a certification to work in the public schools in Washington, and we also have a course on medical SLP issues. You can choose to take one or both of those courses. And then in the last quarter, of course, you have no academic courses because you're fully off campus in your full-time internship. In terms of admissions prerequisites, we have some undergraduate requirements, and those are that you have an undergraduate degree in CSD, or what we also see often is that someone has an undergraduate degree in another field and they have post-bac coursework in CSD. So those are all completely acceptable. We do want to see that the undergraduate or the post-baccalaureate work has been completed within the last 5 years. In terms of GPA, our minimum requirement is that you have a 3.0 GPA. Over the years, the average admitted applicant has a GPA of 3.7. Typically, the GRE is a requirement for our program. However, due to the COVID complications, we have waived that requirement for the 2021 applicants. So we are not requiring a GRE for this year. However, if you want to know the information, we don't have a required minimum, and our admitted students typically score an average of 157 in the verbal portion, 149 in the quantitative portion, and then a 4.3 on the writing portion. But again, that GRE is waived for the 2021 application cycle. We also require some specific undergraduate coursework in order for admission into our graduate program. We do this because we need you to have a good foundation in order to be able to understand and excel in the academic coursework, and because we want to make sure your foundation is strong for ASHA Standard 4B. If you have an undergraduate degree in communication sciences and disorders, or you've taken a pretty established post-baccalaureate program, you probably had all of this information in there somewhere, even if it isn't under these same titles. So The thing that we most often see a deficiency in is a neuroanatomy course or a course in oral rehabilitation. For the neuroanatomy requirement, we do have some flexibility around that. We can recommend some self-study materials for you, but we are strict with our oral rehabilitation requirement because you'll be doing a clinical rotation through our oral rehabilitation clinic. That is a course we do offer in the summer, so if you are admitted, you can come early and take that course in the summer. You can also find an online course if you'd rather do it that way. One other ASHA requirement that I want to bring up are the ASHA requirements for biological sciences, physical sciences, statistics, and social and behavioral sciences. These courses are not an admission requirement for the graduate program, so you can apply and be admitted without having all of these courses. However, you can't start your clinical fellowship year unless you can show that you have taken these courses. So we do recommend that you get these courses at the undergraduate level because there won't be time in the graduate program for you to take these courses. In terms of the materials that you'll need to apply to our program, there is an application and you can go to the grad school and find that application. Again, we are waiving the GRE requirement. We do want to see your official transcripts and your GPA. We require 3 letters of recommendation, and our statement of purpose is a little bit unique. The place where you are able to show your uniqueness and your individuality really is in this statement of purpose. Because if you look at what we really concentrate on, we look at your transcripts and your GPA and your letters of recommendation. And the place for you to explain who you are and tell us what your skills are is really in the statement of purpose. So we want it to be very specific about what we're looking for here. We're not really looking for a recitation of your resume or a review of what you've done in your past. Those things are important, but we particularly value applicants who can demonstrate strong interpersonal skills, curiosity, maturity, self-motivation, dedication to the profession, and who have established strategies for managing stress. So we really want you to address those topics in your statement of purpose within the context of talking about what your skill set is that's related to speech-language pathology. Here's the admissions timeline. Typically, the application system will open in November, and then the application deadline is January 15th. After that, we send out direct admit letters, we develop a wait list, and we send out decline letters in early March. Students who have been directly admitted have until April 15th to either accept or decline that admission. So after April 15th, as soon as we can, on April 16th or on April 17th, we start sending out offers from the students who are on our wait list, and we will continue offering until we have a full cohort. We do keep the waitlist open until school begins in the fall in the event that a student has to withdraw during that time. We have a variety of funding opportunities. We do have 3 full-time TA positions. Those are teaching assistant positions. Those are 20 hours a week, and they also come with a full tuition waiver and a stipend. These are typically assisting in the clinic with administrative responsibilities. We also have 6 part-time TA positions. These are 10 hours a week, and there is a partial stipend and a partial tuition waiver. These cover a variety of positions within the department. Usually they are to support the faculty and the clinical educators with teaching responsibilities. We also support work-study students, and we call those RA positions, and those come through the FAFSA, so that's through the federal program. We do have some in-house scholarships, and those change, so they're listed right on our website. Here's some contact information for you. If you'd like to contact somebody about admissions, you should contact Dr. David Evans through his email here. If you have questions that are specifically about the format of the admissions process, you should directly contact the graduate school. They take care of all those specific details that might come up when you're trying to fill out the form. If you have general questions about the graduate program, you can feel free to contact me. I'm Dr. Kelly Evans. I'm the graduate advisor. And again, email is the best way to reach me. Any general questions can also be directed to our department manager, Karen Smith. Thank you for spending the time with this information session.